Let's bring in Dr. Kristen England, infectious disease doctor at the Cleveland Clinic. Dr. England, thank you so much for being with us. Obviously, a lot to potentially be concerned about here. I'd like to start with one thing that really stuck out. The study's reporting that 100% mortality rate in mice. How significant is that?
I will tell you that rarely do you find studies that are truly 100%. You look at the number of mice that they used. Initially, they used 4 mice, then they used 8 mice that were infected. So we're talking about, first off, 12 mice. That's a really small number. Next, I want to tell you that this is a preprint article, which means it has not been peer reviewed. So there's a lot that still could be flawed in the way that they conducted the studies and the way that they're reporting the studies. Simple things like reporting that the mice, that their eyes turned white, to me sounds very kind of horror film-esque. We don't usually make that kind of a statement in a scientific paper. There would be much more detail about that. So I've got a lot of questions about the validity of this test, or of this report. But I do think it's certainly important that we do listen to a lot of the data coming out of China, because they do a lot of testing on coronaviruses.
And you called it a preprint article. And so maybe my first question should have been to you, after reading this, how concerned were you as a physician, as a doctor?
I really wasn't, to be honest with you, in doing some research and looking at this specific virus. It has been tested before, and it has been tested on mice, and it was a variant of a coronavirus that's in basically a Southeast Asian anteater. And they've been looking at it to try and see if they can use this virus mutant or variant to try and make vaccines. So it's not necessarily a new virus that I'm reading. What I'm reading is that they modified these mice pretty significantly and put a lot of receptors so that they have a lot of these ACE receptors. And over the years, we've heard about ACE receptors, and that's what COVID likes to latch onto to get into the cells. We don't have a lot of those in our brain. There's some on the neurons in the brain, but they've modified these mice to have a lot of these receptors in there. So it's really not human-like.
Right.
And they even admitted in their paper that the company that had produced these mice haven't put out a lot of any significant reports about what these mice are comparable to.
Okay, well, I think that is certainly a bit reassuring there. But we saw what happened back in 2020. I think, in 2019, you would have asked any of us, we would have never imagined, what our lives would look like. How concerned should we be?
Well, I think these groups of viruses, these coronaviruses, do mutate or get variants fairly rapidly. And as was mentioned earlier by one of our colleagues in Florida, we do want to make sure that we know what variants are out there and what's being done in laboratories. And they should be very transparent about what they're doing, because we need to make sure we understand, what's the potential for getting out into the communities. But I think we always need to be aware, and there needs to be great news like you're providing here, and at least making us aware of what's out there. But this is certainly not a cause to panic.
Okay. And you said, these studies take place because it is about developing vaccines. We obviously want to be able to protect ourselves. But I think another big question, is there a possibility the strain, regardless of the mice really mimic humans or not, is there the possibility the strain could somehow be leaked?
If this strain is leaked, at least the initial studies that they looked at when they were looking at this virus and trying to make vaccines, those mice did not get ill. And again, we're not mice. So I think there are certainly the potential for variants to develop anywhere in the world, just naturally develop, that could be more dangerous than the ones that we currently have. But nothing that I see right now is particularly concerning.
All right, no need to panic. All right, Dr. Kristin England, thank you so much for your time.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.